It's a good idea to see your primary care doctor first when you're having new symptoms because they can actually help us to diagnose a lot of different conditions. And while it may feel like you have ulcerative colitis based on the symptoms that you've been having, there are a lot of different things that can make you have diarrhea or abdominal pain, and primary care doctors are a great first line of defense. And then they can decide if it's appropriate to refer you to a gastroenterologist for additional workup. When you come in to see first your primary care doctor and then a gastroenterologist about your GI symptoms, one of the most important things to do is provide a really detailed history, letting us know when you're having symptoms, how often, what they're characterized by. So are you having diarrhea? Is it all the time? Is it only after eating certain foods? Are you ever having bleeding or mucus? Are you ever having urgency? Have you been losing weight? Telling us those details, especially how long those symptoms have been going on and how consistently they're occurring, is really important. We'll also ask for things like your family history to understand if there's a higher likelihood of you having inflammatory bowel disease based on people in your family having been sick in the past. Additionally, we'll do things like blood tests and stool tests. This can check for inflammation, it can check for low blood counts or anemia, and along those lines for iron deficiency, which might suggest chronic blood loss. Stool tests can check for inflammation in the bowel wall and also for infections, because stool infections can cause a lot of the same symptoms as ulcerative colitis, and sometimes ulcerative colitis is precipitated by an infection, so it may be both things going on at once. Sometimes a doctor will want to get imaging, which could be anything from an X-ray of your belly to a CT scan or an MRI. The most important thing for a gastroenterologist to do in diagnosing ulcerative colitis is a colonoscopy. This is when we take a camera that's attached to a long tube called a colonoscope and look at the entire colon and the very end of the small intestine. And while we're in there, we'll take tissue samples or biopsies. We'll want to know what the colon looks like to our eye. So do we see things like ulcers or other signs of inflammation like redness or bleeding? Getting a new diagnosis of inflammatory bowel disease can be really overwhelming. Also, just know that your gastroenterologist will be with you every step of the way. We'll let you know what happens as we find out the results of these tests. We'll be able to tell you right after the colonoscopy what we saw with our eyes, and within a few days to a week, what we saw under the microscope. And just having that information can be really, really therapeutic, because then you actually say like, wow, I've been feeling so bad for so long. I actually know what's going on, and now I can have a plan to feel better.